Sedation is giving a child a medication to help them through a procedure or a radiology study. We give them medicine at a dose appropriate for their weight and help them to enter a sort of a sleep state, and that keeps them quiet or not have any pain during any sort of procedures. Pediatric sedation uses a different set of medications than anesthesiologists use. Our patients will be breathing on their own, and they usually recover quicker than they do with anesthesia. Children also do not have any long-term problems during the day after sedation and usually can go back to their usual activity. Our sedation nurses will call a couple days before the planned procedure or test and review the child's medical history. And they'll ask several medical questions related to adverse effects from any medications or previous medical history that would be significant. And if there are no red flags through that process, then the child is usually safe for us to sedate and does not need to have an anesthesiologist. We like children not to eat or drink so that they have an empty stomach during sedation. Some children may vomit while they're sedated, and having an empty stomach is important so that nothing gets choked on or aspirated into the lungs. That could be a serious complication we try to avoid. We usually recommend that children wait until they're healthy to undergo sedation. Being ill or sick puts you in a high-risk category, and there are sometimes more complications getting sedated while a child is sick. When a child arrives for sedation, the nurse will greet you and get the child's weight. Then she'll review the medical history and make sure that there are no problems. Also review any recent medical history, including fever or cough or any sort of illness that would make the child sort of high risk for the sedation that day. Then the nurse will put on patches to start the IV, and that's a numbing medicine. It usually takes about 20 minutes to take effect. After that's ready, the IV will be placed, and then the sedation physician will come in and talk to you, usually to review some of the medical history and do a quick physical exam. At that point, when the sedation is ready to start, the nurse will attach all the monitors and make sure that the heart rate and the blood pressure and the oxygen are fine. We'll start the sedation medication. Most children fall to sleep in about 3 to 5 minutes after the medicine is started. Some children will fight it a little bit. Once they're asleep, though, we have the monitors going the whole time, and the sedation physician and nurse will watch the patient while they're asleep and watch the monitors during the entire procedure. Once the sedation is done, we turn the medicine off, and it takes about 5 to 10 minutes to wake up at that point. Once the procedure is complete and the child is awake, our sedation nurses will offer something to eat and drink at the completion of the procedure. We let one parent or guardian stay with the child throughout the procedure from start to finish. We ask the parent to sit in a designated spot at the foot of the bed once the sedation starts, and then while the sedation is going on, to remain seated just for the safety of the child. We like the children to return to their normal baseline mental status, and most children can do that in 20 minutes or so. Most children are fine after they're sedated for the rest of the day. We do recommend that a parent or a guardian keep a close eye on them just to make sure that they're acting normally and behaving appropriately. Usually within 24 to 48 hours, the radiologist or the ordering physician will have a copy of those results, and you can call your physician who ordered the test to get that.